So let's start by practicing a really passive seated forward fold. If you normally like to sit on something when you fold, just for this practice for a second, I suggest you don't do that and you actually come to sit on the mat. And then if you stretch your legs out and let your legs go super floppy, and then slowly begin to fold like a rag doll. And obviously at any moment this feels uncomfortable, you can back off. So let your head release a little, just let everything sag and flop. Take a moment to kind of really relax into this. Just start to notice how far you've moved, maybe compared to your typical forward fold that you do in your practice. And then notice your breath and notice any particular sensation that is arising here in this position. And then after a few moments, just ease back out of this. So what I'm imagining is that most of you found that you actually didn't fold as far as you typically would when you're practicing. And you might have also noticed that until I mentioned the breath, you weren't really thinking about the breath. So having done this with a lot of students, I think most people's experience is that the breath in that position is quite shallow. And then in terms of sensation, you know, I actually felt it in my neck, in the back of my neck. Some people feel it in their calf muscles, hamstrings, glutes, lower back. The common denominator is the back of the body. It's a forward fold, it's going to stretch the back of the body. So we're now going to switch this up a gear and make this pose active. So if you like to sit on something to fold, please do. You can sit on a bolster, cushion, blanket, whatever you need to. And also, if you like to roll your thighs inwards in this position, you can do that. And later in the course, we'll explore what this is actually doing to our anatomy. So I invite you to squeeze your legs together, draw your feet back towards your shins, sit up, nice and tall. Take a deep breath in, and when you're ready, exhale and fold a little bit, and then repeat the breath a couple of times. Fold a little bit deeper, and just notice where you travel to without forcing. Keep the front body active, so keep the feet drawn back, the kneecaps gently lifting, the lower belly maybe draws up in like a zip. Notice your breath. Notice how far you've traveled. And notice any sensation that is arising in your body. Take another moment and slowly come back to vertical. So what many of you will have noticed is that you traveled further. You actually folded further in this position. So we are going to look at a theory that tries to explain this, and this is called reciprocal inhibition. And what this tells us is that when we contract a muscle, so think of all the muscles along the front of the body that we gently contracted there, this sends a signal via the spinal cord, so it doesn't go right up to the brain, but just loops over the spinal cord and goes to the opposite set of muscles, and it tells them to relax and lengthen because essentially they might be at risk of injury. And then this allows us to go a little bit further. But what the latest research in biomechanics actually tells us is that muscle pairs don't really behave in this way. Muscles actually co-contract. So it's really impossible, to fully relax a muscle when the opposing muscle is contracting. So both sets of muscles across a joint contract, but one just happens to contract more than the other, and that allows for movement to take in that particular direction. But the thing that might be helping us here, first of all, is that we've really set ourselves up. So we've set ourselves up in our seat, we've created a little bit of space, and we've also connected to our breath. So the breath is going to tell the nervous system that we're safe, and the nervous system is then going to allow our muscle to stretch further. If you remember in Module 1, we talked about muscle as neuromuscular tissue. It is under the control of the nervous system. So I suggest this is why we move a little bit further. So this is reciprocal inhibition.